Welcome to our presentation on gestational diabetes. Today, we will be discussing the understanding, diagnosis, and management of this condition. This presentation incorporates guidelines from the Society of Obstetricians and Gynecologists of Pakistan, SOGP, and the National Institute for Health and Care Excellence, NICE. My name is Dr. Abir, and today's date is June 30th, 2024. Gestational diabetes is a type of diabetes that develops during pregnancy, usually disappears after giving birth. It affects about 2 to 10% of pregnancies, making it a significant concern for maternal and fetal health. Effective management of gestational diabetes is crucial to ensure the well-being of both mother and baby. In this presentation, we will follow the recommendations from the SOGP and NICE guidelines to provide comprehensive and evidence-based information. There are several factors that increase the risk of developing gestational diabetes. These include being over the age of 25, having a family history of diabetes, obesity, previous history of gestational diabetes, polycystic ovary syndrome or PCOS, and belonging to certain ethnic backgrounds such as Hispanic, African American, Native American, and Asian. Both SOGP and NICE guidelines emphasize these risk factors, highlighting the importance of screening and monitoring at-risk populations to ensure early detection and management. Gestational diabetes occurs when the body cannot produce enough insulin to meet the increased needs during pregnancy. Hormones produced by the placenta can make cells more resistant to insulin, leading to elevated blood sugar levels. Understanding the pathophysiology of gestational diabetes helps in implementing effective management strategies to control blood sugar levels and prevent complications. Screening for gestational diabetes is crucial for early detection and management. The SOGP recommends an oral glucose tolerance test, OGTT, 24 to 28 weeks of gestation. Similarly, NICE guidelines recommend an OGTT for women with risk factors at 24 to 28 weeks. The diagnostic criteria include fasting glucose levels of 92 milligrams per deciliter or higher, 1 hour post-glucose levels of 180 milligrams per deciliter or higher, 2-hour post-glucose levels of 153 milligrams per deciliter or higher. These criteria are essential for diagnosing and managing gestational diabetes effectively. Common symptoms of gestational diabetes include increased thirst, frequent urination, fatigue, and nausea. These symptoms can have significant impacts on both the mother and baby. For the mother, gestational diabetes can lead to high blood pressure and preeclampsia. For the baby, it can result in large birth weight and respiratory issues. It is important to recognize these symptoms early and seek medical attention, proper diagnosis, and management. Managing gestational diabetes involves several approaches. Lifestyle changes such as maintaining a healthy diet that is balanced and low in sugars, engaging in regular physical activity, are crucial. Monitoring blood sugar levels is also important. The SOGP recommends self-monitoring of blood glucose levels, while NICE recommends monitoring blood glucose levels 4 times a day. If lifestyle changes are not sufficient to control blood sugar levels, medications may be necessary. The SOGP recommends insulin therapy if blood glucose levels are not controlled with diet and exercise, while NICE guidelines suggest the use of metformin and/or insulin if necessary. Gestational diabetes can lead to several complications. In the short term, mothers may experience high blood pressure and preterm labor, while babies may face hypoglycemia and jaundice. In the long term, both mother and child are at an increased risk of developing type 2 diabetes. Both SOGP and NICE guidelines emphasize the importance of managing these risks through regular monitoring and appropriate medical interventions. Preventing gestational diabetes involves maintaining a healthy lifestyle before and during pregnancy. Strategies include maintaining a healthy weight, eating a balanced diet, and engaging in regular exercise. Regular prenatal care is essential for monitoring and managing health throughout the pregnancy. Both SOGP and NICE guidelines recommend regular monitoring and preventive measures to ensure early detection and management of gestational diabetes. Case study. Let's consider a case study of a 30-year-old woman with no prior history of diabetes. She was diagnosed with gestational diabetes via an OGTT in the second trimester. Her management plan included diet modification, regular exercise, and insulin therapy. As a result, she delivered a healthy baby at term. Her blood sugar levels returned to normal postpartum. This case highlights the importance of early detection, comprehensive management, regular follow-up in ensuring positive outcomes for both mother and baby. Conclusion. In conclusion, early detection and management of gestational diabetes are crucial for preventing complications and ensuring the health of both mother and baby. Gestational diabetes can be effectively managed with lifestyle changes and medication, and regular prenatal care is essential for monitoring and managing the condition. Thank you for your attention. We have now reached the end of the presentation. Would like to open the floor for any questions you may have. Please feel free to ask any questions or share your thoughts on gestational diabetes.